Are You Smarter Than a Fifth Grader? Tonight is a special night here on Are You Smarter Than a Fifth Grader because tonight we are going to teach America about cardiovascular disease, the #1 killer in America, and ways to develop a healthier lifestyle. My name is Kayla Perry and I'll be your host for this evening. So let's get started. First, let's welcome our 5th graders to see how much they know about cardiovascular disease. Here's Carly and Taylor. Now let's bring out our contestant for this evening. She's a 27-year-old zookeeper from Tampa Bay, Florida. Please welcome Allie Pasternak.
Hi, Kayla. I'm very excited to be on the show tonight.
We are very excited to have you here as well. Here's a picture of Allie when she was in 5th grade. I understand you were a very smart 5th grader.
Yes, I was. I have always been particularly interested in animals. However, I'm very anxious to see how much I know about obesity and cardiovascular disease.
Obesity in America and its links to cardiovascular disease is very important because numbers of obese people continue to rise. In fact, 400 million adults are obese and 1 billion are overweight. Likewise, 17.6 million children under the age of 5 are overweight. Since 1980, obesity prevalence in children and adolescents has almost tripled, and no state has met the nation's goal to lower obesity prevalence to 15%. In order to try to decrease the numbers, we would like to help spread awareness on this dilemma. In order to do so, we have developed subjects that focus on obesity's contribution to cardiovascular disease. So let's get you started. Today's subjects focus on stroke, heart attack, angioplasty, healthier lifestyle, smoking, and diabetes. What would you like your first subject to be?
First, I think I'm going to go with heart attacks.
Okay. What ages are obese people likely to have a heart attack?
Knowing that obesity plays a role in the development of cardiovascular disease, I'm guessing that the age will probably be pretty young. I'm going to go with 62 years.
Locked it in?
Yeah.
Okay, let's see what our 5th grader has to say about that. Carly, what do you think?
Compared to the average age of 74.6 years of age, the average age for an obese person to have a heart attack is about 58.7 years of age. So just by eating healthy and having a healthy lifestyle, one can prolong their likelihood of having a heart attack by 15.9 years.
Very good. On to the next question. Allie, you may now choose your next subject.
I'm going to go with angioplasty.
Okay. What is coronary angioplasty?
Angioplasty is a technique used to widen clogged arteries. Locked in answer.
Very good. Let's see what Taylor has to say about that.
I agree with what Allie said. In order to diagnose a coronary blockage, an angiogram is often used. During an angiogram, the tubes enter the coronary vessels, usually via the femoral or subclavian arteries. Dye is injected and watched for any blockage that may occur. An angioplast often follows an angiogram. During an angioplast, a small catheter is inserted into the coronary vessels. A small balloon is then inflated to compress plaque that widen the artery. Later, a stent can be inserted to hold the vessel open.
Very good, Taylor. Allie, you may now choose your next subject.
I think I want to go with stroke.
Okay. What is the death rate due to strokes?
Knowing there are many causes of death, I'm going to have to say that the death rate due to only strokes can't be that high. So I'm going to go with 15%.
Okay, let's see what Carly has to say about that answer.
The death rate due to strokes is approximately 45%. Obesity plays a large role in strokes because having excess weight or being physically inactive can lead to high blood pressure, which is a leading cause of strokes.
Very good, Carly. Allie, now you can choose your next subject.
Now I think I'm going to go with a more positive topic and choose a healthy lifestyle.
Okay. In order to live a healthier lifestyle, what type of meat should be increased in one's diet, and what type should be decreased?
I know this one. Consumption of fish should be increased and consumption of red meat should be decreased.
Very good. That was right on. Now let's hear more from Taylor about healthier eating habits.
First off, breakfast is a very important meal. It contributes to an increased rate of metabolism and can therefore keep off the weight. Other tips to help portray healthier eating habits are to add fish and omega-3 fatty acids to your diet, drink water, and eat dairy, and to just simply set goals for yourself. Developing healthier eating habits is sometimes a difficult task. However, it is not impossible. Have fun with it, and you will see positive results.
Very good, Taylor. Allie, what topic would you like to choose next?
I'm going with diabetes.
Which type of diabetes is caused by obesity?
I'm going to have to say type 2 diabetes.
Very good. Now let's see what Carly has to say about that answer.
Type 2 diabetes is caused by obesity. Obese people are more likely to develop type 2 because hypertension, which results from obesity, and high-fat diets, which contribute to obesity, are the causes of type 2 diabetes.
Very good, Carly. Allie, you may choose your next subject.
Smoking.
Okay. Considering that smoking is a risk factor towards cardiovascular disease, by what factor is the death rate for those obese smokers compared to people who are normal weight and non-smokers?
I'm going to have to say the risk of death for obese smokers is twice the amount.
Let's see what Taylor has to say about your answer.
The risk of death is 3.5 to 5 times greater for obese smokers than for people who are normal weight and non-smokers. With this fact, 20% of obese adults in the United States smoke, and the number of obese smokers has increased 6 to 11 times under the age of 65.
Very good, Taylor. Allie, you may now move on to your last subject. Joe Blow went into his yearly doctor's appointment. He was getting his blood pressure taken, and his doctor said it was abnormally high with a reading of 162 over 105. The doctor said to keep track of his blood pressure to determine if and which stage of hypertension he could have. His readings were continuously very high, and he also had been diagnosed with kidney disease. Which type and stage of hypertension does Joe Blow have?
Well, because his blood pressure is so high, I know it would be stage 2. However, I'm not sure about the type, so I'm going to guess secondary.
Good. Let's see what Carly has to say about your answer.
I agree with your answer. Hypertension refers to the pressure that blood applies to the inner walls of the arteries. Normal blood pressure is around 120 over 80. Stage 1 hypertension is 140 to 150 systolic over 90 to 99 diastolic. Stage 2 is greater than or equal to 160 systolic over greater than or equal to 100. Essential hypertension is poorly understood and may be due to hereditary kidney problems and neural activities. Secondary hypertension is a result of a different underlying medical issue such as kidney disease.
Very good, Carly. Well, that seems to be all the time we have for today. Thank you so much, Allie, for being a part of our show and helping us spread awareness on obesity and cardiovascular disease.
Thank you for having me. I'm very happy that I now know the knowledge to help me develop a healthier lifestyle and reduce my risk for cardiovascular disease.
Obesity is an important determinant of cardiovascular disease. Remember, the study of obesity and cardiovascular disease should now focus on weight change over time. especially differences between childhood versus younger and older adult weight gains and distribution of body fat, especially visceral and intra-abdominal fat. In fact, weight gain during adult life may be one's most important determinant of cardiovascular risk factors.
Even though there are several contributors to cardiovascular disease that are outside of one's control, such as family history, age, sex, and stress, there should be no excuses for not trying to reduce obesity as being a factor.
One's diet and amount of exercise contributes greatly to the risk for cardiovascular disease. In order to prevent this, one should work very hard to keep their body healthy and exercise every day. If you are having trouble with balancing your diet, you can visit www.choosemyplate.gov. This website will guide you to personalize healthy eating habits and help you with it to live healthier life.
Thank you so much for joining us today, and I hope you learned a lot about how obesity contributes to cardiovascular disease. Tune in next week to learn about the digestive system. Goodbye and see you next week.